Let me preface one of the lessons that we've learned from Quentin. At my orientation for the Boston Healthcare for the Homeless, there was an enormous amount of time spent on how you should be sure to sort of avoid getting too involved with your patients. You know, don't overstep professional boundaries. And these blurring of boundaries are considered unprofessional. It interferes with the therapeutic relationship. It threatens your safety and your patient safety. It hurts everyone. Now, feminist and anti-authoritarian approaches challenged this while we were growing up as medical students and physicians, but in the 70s. So we were suspicious of this approach to professional behavior then. And then there was Quentin. Quentin was a very bad role model for us in terms of this. And we willingly and lovingly picked up all his bad habits. Quentin's relationship with his patients knew no boundaries. Organizing for political demonstrations, lobbying politicians, disrupting visits for key phone calls, meeting outside of the office, befriending in real ways were all part of how he appreciated and served patients. Here's how Quentin put it in one of the few academic articles in the Archives of Medicine. In 1975, he said, "We were faced with the rapid disappearance of the human interaction essential to the healthcare experience. In its place is found a technological transaction. Relating is replaced by non-involvement and commitment by a bureaucratic response." Quentin, of course, even now is tremendously involved and busy. He always found time, however, for us and everyone else, which is a model for us as we strive to be mentors for others. We would call Quentin when we needed input into key professional, personal, and political decisions. He listened, got it immediately, and helped tremendously. He and Ruth came to several dinners we organized in the past decade for Chicago area progressive medical students, helping us carry on a tradition we first encountered at the Urban Preceptorship. And there were many times we didn't have to call. He was the first person to show up the next morning in the Michael Reese neonate intensive care unit when our son Eugene was born 9 weeks early. Another major lesson we learned from Quentin was how doctors and patients have to work together. Quentin described how the medical system divided patients and providers. Quote, this is very Quentin-esque: "Depersonalization of the individual and destruction of the community, the emblems of our time, are conspicuously manifested in the role models enacted in healthcare settings. A revised concept would envision changes in the roles of physicians, nurses, and other health providers, and in the role of the patient, who would come to be regarded as the keeper of his or her own medical health, capable of intelligent decisions when he or she became ill." So Quentin argues regularly that doctors and patients have to be on the same side, not antagonists, working together for better care for each individual patient, as well as to transform the healthcare system. It's that alliance that will change the health system so it's accessible, universal, and designed around meeting the needs of people and not profits.
And just one last principle that we learned, or we see Quentin modeling for us, is really sort of thinking as a doctor to diagnose some of the problems with the health system, and even sort of using medicine as a metaphor as well as a lever and a lens. I mean, I was just going through some of Quentin's papers. I mean, things, he's always prescribing this or that. Talks about the myths of patients as gluttonous addicts for tubes or rectal exams or tests. Managed care is a virus, a contagion corrupting physicians' values. Actually very concerned about not only the effect of all this on patients, but on physicians' professionalism. Sicko was moving the nation beyond paralysis into action. Again, all these medical metaphors. The constipated legislative process in Springfield. How about this one? Cook County health system is flatlining. Remember that editorial of Quentin's? Incremental health reforms as placebos and soporifics. And actually, I have one verbatim quote here. It says, some of these incremental health reforms that are being proposed, it will do about as much good as a couple of aspirin will for a headache for a brain tumor. We have to make a diagnosis and then give treatment. The diagnosis is clear. We have a failed experiment with market forces. So Quentin is, again, I have a hemorrhaging, a bunch of other these metaphors that he's constantly using, but I just want to end with one image of Quentin, which I think those of us in the room, several of us heard this talk that was given by Paul Wellstone. It was a conference, and they had a question and answer period, and Quentin got up and started making one of his grandiose speeches, you know, invoking slavery and the end of the civil rights movement and the anti-war movement and suffragette, and going on, and they said, you know, 2 minutes, Dr. Young, what is your question? And Quentin just kept going, Dr. Young, do you have a question? Please sit down. If you don't have a question, Quentin just kept going on, as all of us have heard him do. And the speaker was doing everything they could to cut Quentin off and stop this prolonged, you know, rousing speech that Quentin was giving. He says, Dr. Young, do you have a question? And Quentin said, yes, I do. Am I not right? And yeah, I would say, Quentin, you were right. Thank you.